Most people think that all clinical laboratories are in hospitals, but they're not. If you have an interest in working with animals, you could actually go and work at the zoo in a medical laboratory, or you could work for an instrument vendor. They have clinical laboratories inside of their locations because they are testing out the reagents, the QC products that we use inside of the clinical laboratories that's in the hospital. You will find them at the vendor site, so that's an option as well. Research as well is an option, and or if you want to work in clinical trials, there are other laboratories that you can work in. So don't think traditional lab. And also, if you like to be an inspector, if you have a degree in medical laboratory science, you can go and inspect other laboratories to make sure that they are doing what they should be doing, keeping high quality and keeping patient care first.
You can focus on a rural setting of hospitals. You can focus on a gigantic hospital. I have a colleague who has a really neat path where I live in Minnesota, and there's a lot of reservations there. So he worked at a hospital on a reservation, but it stems or branches beyond that. Like I mentioned, there's reference labs. So those are independent businesses outside of hospitals, typically, that people from all over the world can send samples. There's also physician's office laboratories, so very small, all different types of laboratories outside of the hospital.
Morrill County Community Hospital is a small community hospital in rural Nebraska. We serve several counties, and it's a critical access hospital with 25 beds. However, our laboratory serves our specialty clinic, our ERs, our hospital side, and 3 other sites, including 2 nursing homes.
You could work in industry. There are industry labs that do work. You could also work in the governmental sector, either in a public health laboratory, or in my case, in a laboratory or office devoted to death investigation. So I actually work in one sort of laboratory where we're examining bodies and performing autopsies, but I myself end up procuring samples, say blood or urine, and sending those samples to a toxicology laboratory, which is more of the test tube sort of laboratory, where they perform analyses that we need in order to determine what caused death in each case.
Being able to do a little bit of patient contact, which if that's desirable for some folks, I know other laboratorians would rather be as removed as possible, but that was desirable for me because then you're then putting a face in person with a specimen or test or what you're doing, and then you're seeing that person over and over again whenever they come in their regular routine labs, and so you build relationships, and then you see them out and about throughout the tribal land that I actually lived on as well, on the medical compound there. So there's more of a connection there. So it depends on where you desire to be.
Well, there are a number of places a medical lab professional might work. There are reference laboratories and public health laboratories like the state health departments or even the CDC. There are blood center laboratories and specialty laboratories like toxicology, or some pathology laboratories. Forensic laboratories might employ laboratory professionals as well.
Depending on if we're talking about clinical or patient care, they can be attached to a hospital, they can be a point of care. Like I work at a digestive health, colonoscopies, endoscopies. There's also dermatology places that have their own histology department within them. They can range from research to veterinary to plant biology even. So they don't always have to be attached to a hospital. Sometimes they deal with research.
So many of our graduates, I'd say 70 to 80% of most graduates from these programs are going to end up in hospital laboratories. That's the core employer. But many like me might end up in a public health lab. They might end up in industry. We desperately need people in education, faculty members as well, to educate these future medical laboratorians, regulatory agencies, teachers in K-12.
even getting into the food production and the quality control behind that, environmental science, you have a much better understanding of the science and the chemistry and all those sort of things that are necessary. Forensics, you can again, there's tons and tons of opportunities. Obviously you can do the going and getting an MBA or get into public health and that aspect too, but there's tons and tons of opportunities out there if you're willing to take it. It's not just hospital lab and that's it.